It's really hard to follow all these amazing talks, but I'm going to give it my best go. So, I know from first-hand experience as a parent and grandparent now how it feels to be responsible for the happiness and well-being of a child who, through no fault of their own, experiences exclusion on a physical, social, and cultural basis, and how we as parents experience that same exclusion because of our relationship with and positive attachment to our children, and how the systems of support set up by the state to help us end up disempowering us. However, luckily for me, I had an amazing teacher. My son, who had no formal method of communication, opened up a whole new world to me. He led me to listen to him. He led me to network with inspirational disabled people from around the world who explained to me that impairments of one sort or another will always exist, but that social structures and cultural beliefs can be changed, and that the inclusion of everyone is the only way that we can all fully realise our common humanity. As soon as I understood that, and it did take me a few years, but I did understand it, I was able to start campaigning for change, both within my own family and collectively with other families. And in my early years as a parent, I came together with other parents in Sheffield, and we began to flex our individual and collective leadership. I remember so well the moment it dawned on me that we, as a group of parents, could use our agency and become part of the solution. In 1994, we organised a conference on inclusion in Sheffield. It was the first collective campaigning that we as a group of parents had done. And we felt we didn't know what we were doing, but we managed to get over 100 people to come to this conference. It was on a Saturday, and there were about 20 or so families there and 80 practitioners in the city. And they stayed for the whole day. And in the middle of that day, amongst amazing speakers, about 6 of us parents who had organised the day stood up, and we had little bits of paper. It was before the days of computer and PowerPoints. We had scrappy little bits of paper, and we stood up and told our stories, and we put our dreams for our children on the line. We did not want to accept the status quo. We wanted our children to be included and accepted exactly as they were. We wanted this for our own children and for all children. And although my son is sadly no longer with us, I have the same dream now as I did all those years ago. It shocks me when we were young parents doing that conference. We hoped that in 10 years' time, things would be different. It's more than 10 years, 30 years, and things are still very, very hard. I remember the moment when we nervous parents told our stories, and as we spoke our truth, the silence in the room was charged with a potent electricity. And although we were nervous, some of us were in tears, we were exhilarated and felt strong, because for the first time we were owning our power. And the discussions that we had that day were ongoing. And after my son died, I've been working with many young disabled people and parents. And through our discussions, we concluded what we'd started that day, that we need much more than isolated pots of money or the odd access to a club in order to give our children rich and fulfilling lives. We understood that our resilience was our most precious resource. And through developing that, we were able to create and nurture well-being and inner spirit in order that we have the strength to deal with the knocks that life throws us. We began to understand that the support offered by the state, on the most part, serves to diminish our trust in ourselves and our children and to deplete our resilience. Last night, I was at a workshop with parents. We were thinking about emergency planning. It was of parents of disabled children and adults of all ages. And it struck me how little things have changed, and that this sense of having our resilience depleted by the support, so-called support we're offered, is still there. And one of the parents last night, and I'm going to read her exact words, said, "I've thought about coming out of the social care system as it is causing so much stress, and having them involved is taking away from the positive way of life we are trying to achieve. I worry that they will put all the other things they want to put in over the things my daughter wants and needs." And so over the years, with the help of giants such as Simon Duffy and John O'Brien, parents and families, what Simon and John did were to help us develop this model of real wealth, which is supporting our dreams, our self-belief, and our struggle for equality and justice. And we learned that this model of real wealth can be used individually and collectively, and it can be applied in many different contexts. In the context of disabled children and their families, the model of real wealth supports families to build solutions around their strengths in order to nurture their resilience and take control of their lives. The model of real wealth focuses our attention in 4 key areas needed to create a virtuous circle of resilience. We've got relationships. Family leadership can thrive when parents trust their instinctive love for their child and build confidence in their parenting ability. Sadly, the disabling world we live in, we cannot take for granted that instinctive love for our children. We have to fight for it. Community. We can only thrive as families if we're connected to, valued by, and have a sense of belonging in our local communities. As we've all discovered over the past year, compulsory isolation has a negative impact on our mental health and well-being. Autonomy is essential if we are to feel in control of our lives. This means that families have to be in control of the support they receive. When support from the state is based on legislation, such as children in need legislation, that mistrusts our ability to parent and is subject to draconian conditions imposed by local authorities, it diminishes resilience and agency. And finally, it's the gifts and strengths of disabled children and their parents that need to be acknowledged and valued if we are to shape the world differently. And in these days, all those years ago and now, I've tried so many different ways to change things, but my work is now not so much about helping systems to change, but more to help children and parents believe in themselves and understand that their contribution can have a positive impact on the world.